This podcast is recorded and produced on the lands of the Turrbal people. We'd like to acknowledge the traditional custodians of the land and pay respects to their elders, both past and present. Thanks for joining us again on Fertile Ground, a podcast with Dr. Jodika Ruba, where she answers common questions about fertility and the IVF process. Today we're going to discuss endometriosis and abnormal thyroid function and how they can negatively impact fertility. It's so nice to be with you again, Dr. Jody. Thanks for taking the time. No doubt you see quite a few women who are unsure why they're struggling to get pregnant. And I'm sure often it can be a very complicated answer, but what could some of the potential medical explanations be?
Absolutely. So I might start with endometriosis because that's a condition that can affect 1 in 10 women. Women don't often know they have endometriosis, perhaps until they undertake their fertility journey and find out they're having difficulty becoming pregnant. And that, again, is often the result of women putting up with a lot of pain, which is one of the symptoms of endometriosis. And the pain may occur at the time they have their period, in between their period. It can be very difficult to pinpoint if a woman has endometriosis, but certainly just listening to a woman and understanding how her periods have affected her life and whether or not she needs to take medication for that, whether or not she needs time off work can help point to endometriosis.
I think there'd be a lot of women out there who can relate to that. However, what exactly is endometriosis?
Endometriosis is a condition where sometimes the cells that normally line the uterus can grow outside the uterus, in the pelvis particularly, on the ovaries, and so can affect fertility by affecting our egg reserve, the number of eggs that are left. But we think also the inflammatory process that's caused by endometriosis can also affect a woman's chance of implantation and successful ongoing pregnancy. The good news is that endometriosis can be picked up through some simple investigations. So going to the right ultrasound imaging place where women are seen all the time, and usually endometriosis can be picked up through ultrasound. And most recently, MRI has been also used to determine if a woman may be suffering from endometriosis.
It's great there are other options available other than surgery. So once a woman's diagnosed with endometriosis, what next? What treatment is there, or what does it mean for their fertility journey?
Not all women who have endometriosis may need surgery, but certainly that's one of the options. And we do know that discovering it, knowing about it, having women and couples understand what that means for them enables them to make choices that will help their fertility.
And is it right that it can go easily unrecognised?
With endometriosis, you're right. There are women who have very mild endometriosis, who have very severe symptoms, and women who have the anatomy of their pelvis distorted or tubes blocked and ovaries that grow cysts that contain endometriosis. And sometimes these women are completely asymptomatic. So it is important to actually have that in the back of our minds as fertility specialists, even if women don't express the thought that they may have some of the symptoms of endometriosis, it may be silently causing those issues. So it's important that any fertility specialist keep that in the back of their minds when they're seeing a couple who are having trouble getting pregnant.
And what about the other potential medical explanation we planned on discussing today? I've heard thyroid health also has a big part to play in fertility. Is that the case?
I think that's a very controversial topic. So it has been written about quite a lot recently. I think it depends on who you speak to about thyroid health and how important a role it has to play. We know if you, as a woman, suffer from very low thyroid function or very high thyroid function, that definitely has an impact on the ability to get pregnant because it may affect ovulation and the ability to stay pregnant. So we do know that there is a normal range of thyroid function that we look at, and it is one of the blood tests that we do when we're seeing a couple with fertility issues to try and normalise the range as much as possible. But certainly the focus is not to overtreat when it comes to thyroid function. So not everyone will benefit from thyroid hormone replacement.
Right, well, thanks for helping to explain that complexity. Now, we planned on talking about polycystic ovary syndrome in this episode as well. We're trying to keep these episodes short and easily digestible, and PCOS is another really big subject. So we'll return to that topic in our next chat and dedicate the whole episode to it. Dr. Jodie, thanks for joining us again. Looking forward to the next one.